You know, we've come so many times to Bienville Orthopaedic specialists and talked to a lot of the great doctors that they have here, and they're specializing the different areas that they specialize in. And today we're talking to Dr. Ekaterina Karpitskaya.
That's correct.
So how are you today?
I'm good. How are you?
I'm well, thank you very much. If you would please give us a little bit of background about yourself and what brought you here.
Sure, absolutely. I'm from the country that used to be called Soviet Union, and it's no more. I came to the United States in 1992 and to St. Louis. I did my undergraduate medical school at Washington University in St. Louis, and then moved on to my orthopedic residency in sunny California at UCLA. The Air Force actually paid for my medical school. I was a part of the Health Profession Scholarship Program, and they called me back into the fold after the residency, and that's how I ended up at Keesler and served 4 years as active duty Air Force at Keesler.
Thank you for your service.
You're welcome. And my pleasure. And decided to kind of settle here. Had a couple of kids. This is a wonderful gem of an area for family and children, and just kind of, you know, beaches everywhere. You know, you got
and occasional hurricanes.
Yeah, well, that's, you know, there are tornadoes in St. Louis and earthquakes in California.
Well,
so, you know,
one half does the other.
Yeah,
you know,
exactly.
Whatever you
At
feel
least
like.
there's no snow, so.
But this is true. Yeah,
that's a good thing.
If it snows down here, you know, they just shut down the coast totally.
Yeah.
You're not going anywhere.
Yeah, absolutely.
Tell us about your an orthopedic. Why orthopedics themselves? What drew you to working in that background?
Well, my desire has always been to service people, help people, and orthopedics is such a unique area where somebody is in tremendous pain, somebody is broken, and you can make them whole again with your skill, and you work with a variety of ages, from infants to people in their hundreds. So, I also have background in art. I graduated from art school back in the old country, and I love working with my hands.
Oh, wow.
So that kind of played into it as well.
I know this
That's
is off
why
subject. What's your
orthopedics.
favorite kind of art to work with?
Watercolor.
Watercolor?
Yeah.
Okay, very nice.
So that's why I decided to, I fell in love with orthopedics.
Because you work with your
medical
hands
school.
a lot and helping
Yeah.
people to where they can work, you know,
Right.
better. and
Return
everything.
them back to their active lifestyle.
Because as you said, I mean, it can start out at a very young age. And then, you know, a lot of people think about orthopedic medicine, that's going to deal with older people.
Yeah.
But it's not always that.
It's not true, no. There's always, you know, summer starts, you know, there's bikes and scooters and
Boating.
yeah, boating, kids falling out of trees, you know, things like that. So, yeah.
It's a whole wide range of things because down
Yeah,
here,
we get
down
busy.
south, for
People
the
are
most part, kids like to
active.
get outside and play. You
yeah,
know,
they're
we take their
active.
electronics away from them for a little while.
Yeah.
So they can expand.
Absolutely.
What are some of the special areas that you work in? I mean, sports medicine or anything in particular? I mean, shoulders, knees?
Right. So I do general orthopedics with focus on sports medicine. So I do a lot of knee arthroscopies, ligament reconstruction, shoulder arthroscopies, rotator cuff repairs, and things to salvage rotator cuff when it's irreparable. Do shoulder replacements, I do knee replacements and hips. So I kind of do a little bit of everything, and that's, I think, why many times I consider doing a fellowship, but I just like doing everything so much that I don't want to specialize in one particular area. So,
Are there any differences in some of the orthopedic situations that you see between men and women? I mean, men have more of one thing and women have more of other things or whatever. I would think a lot of women with playing tennis and all that.
Absolutely. You know, with women we see a lot of distal radius fractures, broken wrists, and young girls playing contact sports, a lot of ACL ruptures, injuries.
Soccer, things like that.
Soccer, yes. Also in boys we see a lot of ligamentous injuries, and mostly in men we see long bone fractures, ankle fractures, shoulder dislocations.
Yeah, we get to the point where we're just not as young as we used to be.
Right,
and doing
that's
some
correct.
of those things.
Yep.
So now when it comes to doing the repair work on a lot of these, there's some that maybe they have longer times of recovery that they have to deal with. I mean, like the hips or the shoulders. I mean, rotator cuff. You know, here recently, before the end of the season, Drew Brees had been playing with a torn rotator cuff for a long time.
Yeah.
You know, and yet, you know, we just found out about that. I mean,
Yeah.
is there a long recovery for
It's
something?
absolutely. It's, you know, one of the longest recoveries is, you know, rotator cuff repair. It could take anywhere 3 to 6 months,
Wow.
maybe even up to a year, depending on the size of the tear and the age of the person. And also ACL injuries, you know, you have to commit to 6 to 8 months of rehabilitation process.
And you see a lot of that in all sports.
Absolutely.
You know, the ACL.
Yeah, absolutely.
And so it just takes some time of that. Is there any favorite surgery that is a favorite to you to do, that you feel so much accomplishment
Yeah.
in seeing it done?
I love doing shoulder replacements and reverse shoulders, and also rotator cuff repairs and fracture work. That's probably one that's most satisfying, and kids especially.
Yeah.
Because they just do so great.
Oh, I'm sure. I mean, it's probably hard to hold them down to recover long enough too.
Yeah, well, that's why we put them in casts.
Nail them to the floor, huh?
Yeah, exactly.
And when you think about, you know, shoulder replacement, you know, you think about, I mean, is that really big of an issue in replacing a shoulder? I mean, as far as, I mean, is it just the joint is what you're working with?
Yeah, you basically replace the ball and the cup. So it's a very satisfying procedure, and it's really not that difficult to recover from, as opposed to, say, like a knee replacement or a hip replacement.
Right. Well, I mean, orthopedic surgery has come so far
Yeah,
in the last several
absolutely.
years. I mean, it's wonderful to have physicians like you and specialists that can, you know, work with a patient, and no matter how young or old they are,
Right.
and to get them on the road to recovery.
Yeah.
So if someone is having an issue, I guess they can just give them a call here at Bienville Orthopaedic
Absolutely.
Specialist and set up an appointment with you.
We'll be
And
more
to
than
get a
happy to
referral.
see them.
Not really
Absolutely.
a necessary referral, but to, you know, go through a diagnosis and
Yeah.
find out what you have to do.
Yeah, we can get them in the same day
All right.
if necessary.
Thank you so much,
Yeah.
Dr. Katerina
Kaya.
Karpitskaya. Thank you.
Thank you.
Thank you so much for being here. Anyway, if you like some, you know, if you need some relief, if you have a hip injury, a shoulder replacement, torn rotator cuff, you're trying to be like Drew Brees, what you need to do is give them a call here at Bienville Orthopaedics, set up an appointment, and get yourself some relief, because they can certainly take care of you here at Bienville Orthopaedics here on the Gulf Coast.